I'm Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Let's try to understand the term endometrial receptivity today. What is an under-receptive endometrium? What is the optimum size of the endometrium that is conducive for pregnancy? And what is happening during periods? This is the topic for today. So, endometrium can be divided into two important phases. A thin endometrium and a thick endometrium. Now a thin endometrium is happening at the follicular stage of your menstrual cycle. This is the period where the egg is getting ready, it's growing in size, it's getting ready for ovulation. At that time, during those days, the endometrium has already shed from the previous period and is now getting ready for the potential embryo which may be formed. So during the follicular phase, it's normal for an endometrium to be thin. At the time of ovulation, under the influence of progesterone, this endometrium starts to grow. So if an endometrium is around 8 mm to 12 mm in thickness, it is called as an optimum or a receptive endometrium. This is the size that is required for the embryo to come and implant itself on the endometrial lining. So this endometrium, also called as the thick endometrium, has to occur during the time of ovulation and after the time of ovulation, which is called as the luteal phase, but before your period. During the period, what happens is that this endometrial lining sheds and comes out. So anything above 13 mm means that you are ready for a period. So during period, all this endometrial lining, not the complete one, but the outer layer, the mucosal layer of the endometrium will shed out as a period. So during this thin endometrium phase, it is getting ready for the embryo. At the thick endometrium phase, it is ready for the embryo, and at this stage the pregnancy did not occur, which is why the period is happening. Now suppose you get a scan done in the middle of your period, which is at the time of ovulation, and we encounter a thin endometrium. It is not a good sign, isn't it? It should be around this size so that we can assume that the egg might ovulate. There is a good chance of pregnancy. So the right size at the right phases will increase your chance of pregnancy. This is a very important point to understand. If you wish to understand more about this and you want to see why you are not falling pregnant and your endometrium is the cause, feel free to contact us, get an endometrial scan done, and then see what treatment options can be given. To know more about this, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.